Hello guys, I am Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about granulomatous lesions of nose. The first one is rhinoscleroma. Rhinoscleroma is caused by gram-negative bacillus, that is Frisch bacillus, or we can say it as Klebsiella rhinoscleromatis. Okay, gram-negative bacillus known as Frisch bacillus or Klebsiella rhinoscleromatis. It is endemic in northern parts of India. What is the mode of infection? Okay, so how do we acquire this infection is by air droplet. Okay, so by air droplet these bacteria comes bacilli. This bacteria destroys the mucus producing cells. Okay, so mucus producing cells are destroyed. Since mucus contains IgG, which is not good for bacteria, so when mucus is destroyed means now bacteria can easily grow. Okay, so no mucus, thereby drying nose, and because of this drying nose it leads to a trophic stage. Now coming to see the pathophysiology and the stages of this rhinoscleroma. First one, we have a trophic stage. We got to know how it started. Okay, bacteria destroys the mucus producing cells, mucus is not there, so a trophic stage. So first one is the trophic stage. There is no mucus, foul smelling purulent nasal discharge, and crust will be seen. Okay, second is the granulomatous stage. In granulomatous stage, nodules in the nose is seen giving the woody feel. In questions we'll find nodules in the nose giving woody feel. So how is it formed? So this formation of granuloma is due to dead bacteria in the center surrounded by macrophages and epithelioid cells. Okay, so bacteria in the centers surrounded by macrophages and then epithelioid cells. Okay, these nodules are seen in the lower part of external nose and lip. Okay, the lower part of external nose and lip. Okay, nodules are painless and non-ulcerative. These woody nodules leads to deformity known as Hebra nose. The third stage is stage of cicatrization or healing, stenosis of the nose or nasopharynx. Okay, so our first one was the atrophy, then formation of granuloma, then now the stage of cicatrization or healing. With this we have stenosis of the nose or nasopharynx, tapering of the nose, that is called taper nose, and there will be difficulty in breathing. So the clinical features will be surrounding this only, that is foul smelling discharge, difficulty in breathing, and reduced smell, those things only. Okay, or breathing from the mouth, these will be the clinical features. So how does rhinoscleroma spread? It starts in the nose, spreads to pharynx, larynx, trachea, bronchus. The subglottic larynx is most affected, that is called laryngeal scleroma. Now what are the investigations we need to do? The first thing is tissue biopsy. In tissue biopsy, which in histopathic examination will find Mikulicz cells. Okay, Mikulicz cells that are vacuolated histiocytes. Then we have Russell bodies. Russell bodies are eosinophilic inclusions in plasma cells. Okay, so in HP examination we will find Mikulicz cells and Russell bodies. Then we can go for culture, and the culture is done on Macanchi agar. Coming to the treatment, we have to give streptomycin or tetracycline or rifampicin for a minimum period of 4 to 6 weeks. Okay, streptomycin, tetracycline, and rifampicin for a minimum period of 4 to 6 weeks. Steroids are given to decrease the fibrosis. Okay, treatment is stopped only when two cultures are negative. Okay, so we have to take the culture at least 2 times, it should come negative. 2% acreflavin is used as topical application. Okay, 2% acreflavin is used. Then debridement of dead tissue is important. Okay, radiation only when disease not responding to the medicine, but very rarely perform treatment. Okay, so this was about the rhinoscleroma. Thank you so much.